Okay, imagine this for a second. You're offered some information, something that could really change how you see your future. It's super personal, potentially massive, but, and here's the kicker, there's nothing you can immediately do about it. You just get the information. This deep dive, well, it's about exactly that kind of dilemma, specifically looking at Alzheimer's disease.
Yeah, and it's a scenario that's becoming less hypothetical and more real.
Yeah.
As the science around Alzheimer's moves forward, researchers are getting, much better at estimating someone's personal risk of developing it.
Which sounds powerful, right?
Oh, incredibly powerful.
Yeah.
But it instantly throws up this really big ethical question.
That's the core of it, yeah. So with this new ability, the central puzzle we're wrestling with today is, if you're offered this potentially life-altering information, do you actually want to know your risk?
Especially, and this is key, when there aren't any medical treatments right now that can change that risk.
It's a heavy thing to think about.
It really is. And actually, a recent study, this one came from Washington University School of Medicine in St. Louis, was published in JAMA Network Open, looked directly at this.
Right, and what really jumped out at me, what was genuinely surprising, was the main finding. They found this, huge gap between the number of people who said, hypothetically, yeah, I'd want to know, versus how many actually did choose to get the results when the offer was real.
Mm-hmm. It really highlights that difference, doesn't it, between thinking about information in theory
And facing a very real personal decision about your own health data, especially sensitive data like this.
Exactly.
So this gap, it makes you wonder what's really going on there. Why the difference between saying and doing? Today, we're going to, dig into what this discrepancy means, why people might make these choices, and the bigger picture stuff too, like personal autonomy, medical ethics.
Yeah, it's like we're walking this ethical tightrope. Because on one hand, you have this really strong push for transparency and research, and rightly so.
Makes sense.
You've got organizations like the National Academies of Sciences, Engineering, and Medicine, even proposals for a Bill of Rights for people in Alzheimer's research, all saying, basically, give people their results.
Empower them with their own data.
That's the idea. But then on the other side of the tightrope, there's this major ethical worry.
The anxiety factor.
Right. The potential for real psychological distress, serious anxiety, if someone finds out they're at high risk for something like Alzheimer's progressive, currently untreatable dementia. That's a heavy burden to carry.
And it's different, isn't it? It's not quite like, say, finding out you have a high risk for certain cancers where maybe there are things you can do. Early screening, preventative measures.
Precisely. With some hereditary cancers, early detection can lead to tangible actions, increased screenings, maybe even proactive surgery. For Alzheimer's, well, we're just not there yet. There aren't any approved medical treatments or interventions that can actually prevent the disease from starting if you're high risk.
And the study's senior author, Jessica Mazursky, she put it really well. She talked about this movement toward giving research participants and patients their test results, even in situations when nothing can be done with those results. But she said her study suggests that in sensitive cases, like estimating risk for a disease like this, people should have the option to not know.
That really nails the central tension, doesn't it?
It really does. So, okay, let's unpack the WashU study itself. How do they figure this out?
Well, they tapped into a really valuable resource. They used data from a long-running study called the Memory and Aging Project. It's based at WashU Medicine's Knight Alzheimer's Disease Research Center.
Oh, wow. Long-running like.
Launched in 1979. So they've been studying changes in brain health over decades. It gives them this incredibly rich foundation.
Okay, so a solid base. And for this specific part?
They focused on 274 volunteers from that bigger project. Importantly, these were all cognitively normal people at the time. And these folks went through a whole battery of tests, genetic tests, blood draws, brain scans, everything needed to estimate their probability of developing Alzheimer's dementia within the next 5 years.
Got it. And they didn't just spring the results on them, right?
Oh, definitely not. This part's crucial. Before anyone had to decide yes or no to getting their risk score, they received this detailed information guide.
Okay, what was in the guide?
It explained how the risk was estimated, the science bits, and then it clearly laid out the potential pros and cons of finding out.
Right, the good and the bad. So pros would be?
Well, maybe you find out your risk is lower than you feared. That's huge relief, right?
Definitely.
Or, if you are high risk, maybe it makes you eligible for clinical trials, trying out new prevention strategies that aren't widely available yet.
Okay, potential upsides. And the cons?
The big ones were potential anxiety, obviously. Just knowing could cause distress. And they also mentioned possible complications with buying certain kinds of insurance later on, like long-term care insurance.
Oof, yeah, that's a real-world consequence. So a lot to weigh up.
Absolutely. Now, here come the numbers that really highlight the core finding.
Okay, let's hear it.
When people in the larger long-term study group were asked, hypothetically, if they'd want to know their risk,
Yeah.
a big majority, 81%, said yes.
81%. Okay, seems like most people think they want to know.
That's what it looks like hypothetically. But when it came down to it, for these 274 participants who were offered their actual real risk results,
Yeah.
only 60% chose to receive them.
Wow. From 81 down to 60%, that's a huge drop. Over a fifth of the people changed their minds, essentially.
It's a really significant difference, a 21-point gap between theoretical interest and the actual choice when faced with the reality.
And did they notice any patterns in who was more likely to say no thanks?
They did. The study noted that participants who had a parent with Alzheimer's disease.
Ah, so a direct family connection.
Exactly. And also participants who self-identified as African American, they were both more likely to decline receiving their results compared to others in the study.
That's really interesting. It suggests that personal experience, family history, maybe even cultural or community perspectives, they really play a role in this decision.
It seems so. It speaks volumes about how heavy this information can feel and how different factors shape that very personal trace.
So the numbers show the what, but the really fascinating part is the why. Why did that 40% decide not to know? Did the researchers ask them?
They did. They interviewed a sample of the participants who declined. And yeah, the reasons they gave are incredibly insightful. It wasn't just one thing.
Okay, like what?
Well, a common theme was the idea of burden. People saying that knowing would just place too much of a burden, either on themselves, emotionally, or on their family members.
Right, the weight of that knowledge affecting everyone.
Exactly. Others mentioned their own negative experiences or just perceptions they had about Alzheimer's dementia. Maybe they'd seen it up close and didn't want that hanging over them.
That makes sense. Any other reasons?
Yeah, some people just felt, pretty good about their memory right now. They felt sharp, things are fine, and they didn't want to introduce worry or uncertainty into their lives when they felt okay.
Kind of an if it ain't broke, don't fix it mentality almost.
Yeah, sort of, yeah. Or maybe don't invite anxiety if you don't have to. And then others felt like they were sort of already prepared for the possibility. Perhaps they'd done planning, or they simply acknowledged that these predictions, even with advanced tests, still have some uncertainty.
Right, it's a probability, not a certainty.
Precisely. But underlying a lot of this, and Mazursky, the lead author, really emphasized this point, is the lack of treatment. She stated pretty clearly. The lack of preventive treatments is also a big factor in declining to receive the results among people without symptoms.
That just seems to be the elephant in the room, doesn't it? Knowing something you can't fix or can't prevent medically right now. That's the heartbreaking part.
It really is. It seems to be a major driver for many who chose not to know.
Was there any indication that might change? Like, if treatments did become available?
Yes, actually. That was a hopeful note in the interviews. Many of the participants who declined said specifically that, if a new effective treatment came along, that might absolutely change their mind.
Okay, so the desire to know isn't necessarily gone forever. It's maybe just conditional.
That's a good way to put it. Conditional on the potential for taking meaningful action based on the information.
So thinking about all this, what are the big takeaways? What does this mean for, say, future research or how doctors might approach this?
Well, for research, these insights are really valuable. They can help design future studies where risk information is offered. It helps researchers understand how to offer results in a way that really respects people's autonomy, their choice, without making them feel pressured to know if they're not ready.
Right, recognizing it's not just about having the information, but about the person's readiness to receive it.
Exactly. And it really hammers home the need to distinguish between someone saying, hypothetically, sure, I'd want that, versus their actual genuine readiness when the offer is concrete and personal.
That's a crucial distinction. And just a practical point, these results, because they're from a research study, they don't automatically go into someone's official medical record, do they?
No, that's important. The investigators don't put these research findings into the participant's medical chart. Now, of course, if a participant receives their results, they are absolutely free to share that information with their own doctor if they knows to, but it's their choice.
Okay, good clarification. And it sounds like this whole area, the ethics and practice of returning results, is still evolving.
Oh, very much so. Mazursky mentioned they definitely plan to continue our research into the complexities of these questions, especially because returning results to research participants is becoming more common, even for findings like these, that you can't necessarily act on medically right away. The conversation is definitely ongoing.
So just to kind of wrap things up, what we've really explored today is this incredibly fine balance, right?
Hmm.
On one side, you've got amazing scientific progress, the ability to predict risk for diseases like Alzheimer's.
Yeah, incredible advancements.
But on the other side, you have these deeply personal ethical considerations about sharing that knowledge, especially when there's no immediate medical action you can take to change the predicted outcome.
Perfectly put. And the study just powerfully reinforces how vital participant autonomy is. That includes, crucially, respecting someone's right to choose not to know.
It's not about assuming everyone wants every bit of data about themselves right now. It's about individual readiness.
Precisely. And that leads to a really interesting thought, maybe some for you, the listener, to consider.
Yeah.
As science keeps moving forward and we get better at predicting more and more about our future health, how do we navigate this?
Yeah.
As individuals, as a society, how do we handle this growing landscape of knowing, especially when our ability to act on that knowledge to prevent or treat is still playing catch-up?
And what does it really mean to be prepared for a future that you might be able to predict but can't yet prevent? That's definitely something to chew on.